Good afternoon, and welcome to the Spring Symposium of the Johns Hopkins Center for Mental Health and Addiction Policy Research. My name is Colleen Berry, and I'm the chair of the Department of Health Policy and Management here at the Bloomberg School. And together with Liz Stewart, I co-direct our center. It is a thrill to be here with our students and faculty, as well as our invited journalists and other guests. This public panel is being webcast thanks to generous support from the Bloomberg American Health Initiative. For those of you taking part in our afternoon working session directly following the public symposium, at the close, please join us here up in front, and our students will walk you to the location for the working lunch. We have assembled a fantastic group today to guide us in thinking about the role of the news media in tackling the opiate epidemic in our city and around the country. As all of you know, the statistics are startling. Drug overdoses are the leading cause of injury death in the United States, accounting for 1.5 times more deaths than motor vehicle crashes annually. More people die from overdoses every day than died at the height of the HIV epidemic, and opiate overdose deaths are contributing to reversals of life expectancy gains. The statistics related to the role of stigma in the epidemic are just as daunting. Over 3/4 of Americans report being unwilling to have a person with a history of drug addiction marry into their family or work with them on a job. More than half of Americans report that employers should be allowed to deny employment and landlords should be allowed to deny housing to individuals who struggle with drug addiction. And too many Americans still think about addiction in terms of moral failing. The purpose of our session today is to talk about the critical role of the news media in communicating about the epidemic, both in framing the epidemic itself and our best tools for confronting it. However, it's important to acknowledge that the news media can also be a source of misinformation with the power to exacerbate stigma rather than ameliorate it. A motivation for organizing this convening is to set a bar for achieving the highest level of reporting on the crisis. Before turning to our formal panel, one of the core premises of our work in the center is that language matters, and that words like addiction, junkie, clean, dirty, and habit have the potential to reinforce incorrect and stigmatizing views of people with substance use disorders. So I would make a plea to all of us to aspire to using person-centered language today and always when we discuss this topic. So without further ado, it's my pleasure to welcome Beth McGinty to the podium. Dr. Beth McGinty is a faculty member here at the school and deputy director of our center, and an expert in policy communication, public opinion, and message framing in the areas of addiction, mental illness, stigma, and violence. Beth is going to take about 5 minutes to provide an overview of the limited research on news media communication on the opiate epidemic, and then I'll invite up the rest of our panel. Beth.
Great, thank you, Colleen. Welcome, everyone. Thanks for being at this exciting event this afternoon. So my job here today, as Colleen said, is to give you a very quick 30,000-foot snapshot of what we know about news media coverage of the opioid epidemic. So first of all, we know that news media coverage of the opioid epidemic and public health issues and social issues more broadly has important implications for public knowledge and attitudes. Americans report getting the majority of their information about health issues from the news media, and we have large bodies of communication research showing that news media coverage of health and social issues can influence attitudes along a variety of domains, including perceptions of the significance of the problem, preferred solutions to the problem, and attitudes about the population affected by the problem, in this case, people who use opioids. And of course, those attitudes can then influence political debates, for example, by affecting what policy solutions to the opioid epidemic the public prefers. So what do we know from the research evidence about how the news media has covered the opioid epidemic? The research is very limited. There are 2 studies, both conducted by our group here at Hopkins. The first one examined overall news coverage of the opioid epidemic from 1998 to 2012, so relatively early years and potentially a bit dated at this point. And then the second is a brand new, hot off the presses, not actually published yet, so you're getting a preview of results, study led by Eileen Kennedy Hendricks that looks at news media coverage of medication-assisted treatment from 2007 to 2016. And just before I give you my snapshot of results from those studies, just a very brief summary of what the methods looks like so we're all on the same page. When we do these studies, we're looking at a national sample of news media coverage, so we select a group of high circulation, high viewership, high web trafficked news sources from across the country, usually national and regional news sources. And we pull a sample of news stories from those news sources, about the topic of interest, and then do a sort of structured coding process where we examine the topics mentioned within those news stories. So that's the kind of study that I'm talking about here. So the take-home message from the first study was that from 1998 to 2012, news media coverage of the opioid epidemic predominantly framed the issue as a criminal justice issue, as opposed to a public health issue. And so you can see from this graph some examples of the criminal justice framing. Those green bars at the top, between 55 and 70% of the news stories that we looked at framed illicit drug dealing as an important cause of the epidemic, focused on law enforcement-oriented solutions, arrests and prosecutions, and depicted people using opioids as engaging in criminal activity. In contrast, less than 10% of news stories mentioned pharmaceutical companies as an important cause of the epidemic. About 40% of news stories mentioned some kind of prevention-oriented solution like education or a prescription drug monitoring program, but only a little over 10% mentioned treatment expansions, and 2% mentioned harm reduction-oriented solutions during this period. And then in contrast to the nearly 70% of depictions of people using opioids as criminals, only about 35% depicted people who were engaged in treatment. So as I signaled a couple of slides ago, this study period is a bit dated at this point. And there were some signals in this study that towards the end of our study period, coverage was changing. So in the last 5 years of this period, specifically, we saw an increase in the proportion of news stories mentioning prevention and treatment-oriented solutions, and a decrease in the proportion of news stories mentioning those arrests and prosecutions, the criminal justice-oriented solutions, suggesting that perhaps we caught the tail end of a period when there was at least a bit of a shift away from this criminal justice framing and towards public health framing. All right, and then our second study of coverage of medication-assisted treatment. So in news coverage about MAT, buprenorphine was the most frequently mentioned medication, followed by methadone. Naltrexone was mentioned less frequently, potentially because it wasn't being talked about in the earlier portions of our study period so much. Somewhat concerning, counseling or therapy was only mentioned in less than a third of news stories, and medication-assisted treatment, right, means medication plus counseling and therapy, but often the focus was really just on the medication. We were very interested in capturing news media mentions of some true-false messages based on our perception that there are a lot of myths in the public dialogue about medication-assisted treatment. And so I've given you a snapshot of a few of those. So 26% of the news stories that we examined correctly noted that these medications are effective. 4% claimed that they were ineffective. 4% of news stories specifically stated that these medications are not another form of addiction. 9% stated that they are another form of addiction. 16% of news stories correctly noted that people using these medications are not high. They're not experiencing euphoric symptoms or euphoric side effects. And 3% stated that they are actually high. And then 40% of news stories mentioned a policy to expand access to medication-assisted treatment, broadly speaking, any type of policy. So as promised, that was my very quick 30,000-foot snapshot. For those of you staying this afternoon, we can talk more about these studies. Clearly, the research is very limited, and this is an area that needs more work, and I am really excited to hear our panel's perspectives on news coverage of this issue. Thank you.
At this point, it's my great pleasure to invite up our panel. I'm going to introduce them as they come up to the podium. Michael Botticelli is our moderator. He is our Distinguished Policy Scholar this year at the Johns Hopkins Bloomberg School of Public Health. Michael is Executive Director of the Graken Center for Addiction at Boston Medical Center. He's one of the nation's leading experts and has served as the Director of the White House Office of National Drug Control Policy under the Obama administration. It's been such a pleasure to have Michael with us on campus today. I and all of my colleagues and our students have learned enormously from Michael's expertise. In addition, I'm pleased to welcome Lenny Bernstein, a health and medical reporter at the Washington Post. He's spent more than 20 years as an editor at the Washington Post and the Los Angeles Times and has written about the opiate crisis since 2015. Welcome, Lenny. Herman Lopez is senior reporter at Vox. He's written for Vox since it launched in 2014 with a focus on criminal justice, guns, and drugs. Previously, he worked at City Beat, a local newspaper in Cincinnati covering politics and policy at the state and local level. And Josh Katz is a graphic editor for Upshot at the New York Times, where he covers a range of topics with a visual focus, including politics, sports, culture, and the opiate crisis. Before joining the Times, I love this part of Josh's bio, he earned a master's degree in statistics. Josh's work focuses on finding meaning within numbers and turning data into stories, something that here at our esteemed academic institution we should all be as good as possible at as well. Last but not least, I want to invite up Rebecca Palpant-Shimkitz, our discussant. Rebecca is the Senior Associate Director for the Carter Center's Rosalind Carter Fellowships for Mental Health Journalism, where she has the pleasure of training many journalists every year in reporting on addiction and mental illness. Please join me in warmly welcoming our panelists, our discussant, and our moderator.
Well, good afternoon, everybody. It's really my pleasure to be here. Lenny was asking me on the way in if this is my opportunity to get back at the media for all of the tough questions and issues. I promise I won't do that. But I really want to thank the Johns Hopkins Bloomberg School of Public Health, not only for the opportunity for me to be here, but also I think on this very important topic that has implications on multiple levels. And I think you all know how particularly important this issue is for me personally, as a person in long-term recovery who, unfortunately, I think experienced and to some extent still experiences some of the issues of stigma as it relates to people with substance use disorders. I thought I would do just for a couple minutes, and Colleen began with this issue to really talk a little bit more in terms of the manifestations of stigma and how that gets reflected out. And this list is by no means exhaustive in terms of the multiple ways that how our attitudes about people with substance use disorders play out on a variety of different levels. So first and foremost, on the individual level, we know that stigma plays a leading role for people to avoid seeking care or delaying seeking care. We know that fear of what family and friends and employers will do with that information plays a distinct role in people delaying seeking care, often to when their addiction is most acute. And we certainly know that people with substance use disorders, because of the stigma, experience profound loneliness and isolation as it relates to their condition. But we also know that manifests itself on the clinical level. Numerous studies show how people with substance use disorders experience incredible amount of judgment and shame as they interact with the healthcare delivery system. It's really important. And in this time when we know people with substance use disorders also have comorbid health conditions, they often withhold that information around their substance use and their substance use disorder for fear of being judged by healthcare practitioners. And I think also, alarmingly, an unwillingness to assess and treat, despite the fact that this is one of the most prevalent conditions that healthcare providers will going to experience. Colleen talked about the way that this has manifested itself on the policy level. I would like to think, Colleen and Beth, that during the course of the Obama administration, that was part of the reason why we began to see some shift in public attitude about this. But historically, we have seen this as a criminal justice issue. And I will say that if you look at the trajectory of federal government spending on this, it actually is, I think, a great illustration of how public attitude and policy gets played out in the budget. So during the course of federal spending since 1988, the vast majority of federal government resources against drug use and its consequences has been on criminal justice and law enforcement approaches. It wasn't until the end of the Obama administration that spending on health approaches actually equaled those for supply reduction and law enforcement strategies. But we also know, as Colleen talked about, the way that public attitude not only reflects itself in funding, but in the attitudes of people in terms of less deserving of benefits and other supports to do that. And I think perfectly illustrated by the long history of insurance discrimination for both public and private payers as it related to benefits on par with other medical conditions. But it also manifests itself on the societal level as well, and just an overall lack of empathy for people with substance use disorders. Colleen already talked about the role that language plays in this. I was struck by a recent Blue Cross Blue Shield survey that was conducted in Massachusetts, even good old liberal Massachusetts, that more than half believe the opioid epidemic is a public health issue, which is good, rather than a law enforcement issue. Yet only 4 in 10 believe that addiction is a disease, and 28% says it's a choice. Fully 82% of people believe that people who are addicted to opioids bear all, most, or some of the blame for their own addiction. And, we're here today to talk about the role that the media has played and can continue to play in terms of this epidemic. And, really thrilled and honored to be joined on this panel by 3 people who I've known for a long time who have done exemplary work in covering this epidemic. So we've given them 8 to 10 minutes of fairly significant latitude, so we don't know what we're going to get here, but it promises to be exciting. But I think we asked them to really focus on their own, based on their own extensive experience in covering this issue, what they've encountered, how they approach their work, the role that stigma plays, to the extent that they feel comfortable intersecting with the rest of their news colleagues and the other folks in the newsroom as it relates to coverage of this. And then we'll have Rebecca, I think, tell us a little bit about her work and summarize this. So I'm going to start with Lenny Bernstein from the Washington Post and just ask him to give 8 to 10 minutes on his thoughts and reflections here.
Thank you. Is this on? Yes. Great, thank you. Thanks so much for having me and for being nice to us. In 2015, the Post was writing a series of stories about heroin. We were sort of in the heroin phase of the epidemic. And I was asked to write about something that was fairly unknown at the time, and that was NAS babies. And I remember starting out to do the research for that story, and I must have made 24 phone calls to medical facilities all over the United States. And it was a pretty difficult request, and it was, I need to speak to a mom who's recently had an NAS baby or is in recovery with an NAS baby, and we need to be able to shoot photos. And that took weeks and weeks and weeks to get accomplished. I was actually pretty confident we were never going to get that story, at least not back in 2015. And that's not to criticize medical facilities, because you all are governed, they all and you all are governed by privacy laws and HIPAA and lots of things. And frankly, I would think long and hard if someone asked me for that request. About 2 weeks later, there was something that also was sadly still a rarity back then. There was a fentanyl cluster in Washington, a small town, Washington, Pennsylvania, a small town near Pittsburgh. And I called the mayor, I called the DA, and I said, could I come out and do a story on this fentanyl cluster? And the response was, God, yes, please come, hurry, we need help. I just thought that the contrast of two stories in 2 weeks would give you guys an idea of what we in the news media are completely dependent on to get our jobs done. The first thing is access. The second thing is for people to be willing to tell us what is going on out there. On any given day, I probably get 100 pitches by email and several more by telephone. Many of them for products. I don't have to read deep into the email to know I'm not going to do something on them, but many of them are important. They come from research journals. They come from people who want me to set up interviews with them as they go through town. And at the same time, I may be weeding through other things that editors want me to do. I may be writing up stories. I may be trying to do reporting. We are pulled in a million different directions at once every day. And without people like yourselves and others, Michael, sort of telling us, hey, this is what's going on out there. This is what's at the cutting edge. We really can't do our jobs. So the first point I'd like to make is how dependent we are on people who are actually doing this work, staying in touch with us. If you are thinking, if you have an idea and you think, should I call? Is it going to be something they don't want to hear about? The answer is yes, call. And if you want to email, the answer is hell yes. And if you want to follow up after that, the answer is still yes. I'm sure these guys will agree with you that we are in constant learning mode as reporters. We are constantly curious about what is going on out there, and we are constantly trying to tell our editors and our readers what is new in the fields that we cover. The thing you do not want to hear when you pitch a story is, I know that already. If your editor says that, what he or she is saying to you is, our readers know that already, and I need to know something that's newer and that's different. At the end of 2015, two researchers, Ann Case and Angus Deaton, put out a study that was rather startling to us in the media and a whole bunch of other people. They said that white middle class and working class people were dying at a very startling rate. They said it was basically the diseases of despair, suicide, drugs, and alcohol. And this study made front page news across the country. Why was it startling? Probably for the same reason that we in the media missed Donald Trump's election. We don't live out there. We are not in those communities. We live in cities. The major media, by and large, lives in large cities. And we missed this story, and it took two researchers at Princeton in an ivory tower to point it out to us so that we could get to work on it. And then we all have worked on it quite a bit since then. I forget who I first heard doing this, but show of hands, how many people in this room own a pickup truck? Right. How many people know somebody who owns a pickup truck? Okay, better. Better. But it illustrates where we live and what we are hearing about and the people that we're talking to every day. When we get it right, the results can be pretty startling. In 2016, a reporter named Eric Iyer at the Charleston Gazette-Mail, 42,000 circulation paper, decided he was going to show how many opioid pills were pouring into West Virginia. Mm-hmm. And he had to enlist the aid of pro bono lawyers, and he had to file lawsuits because he works for a small paper that doesn't have a lot of resources. He showed that 780 million opioids had been delivered to West Virginia in 5 years, West Virginia population being about 1.4 million people. And he won a Pulitzer Prize for an investigation for doing that. Just yesterday, the Cincinnati Enquirer won a Pulitzer Prize for local reporting. They devoted their entire staff for a week to illustrating the opioid epidemic in Cincinnati. And I urge anybody who still needs to see what this looks like on the street to go call that up and read it. Some of you already know this. Josh Sharfstein calls me all the time, and he says, well, that was a good post, but you really didn't say enough about MAT. And he's invariably right. Point taken. Myself and a partner at the Post have spent the past 2 years writing about the DEA and how drug companies have pretty much had their way with the drug companies, how they have out-lawyered them, outmaneuvered them, and beaten them in Congress. One of the few people who had the courage to go on the record about that is the fellow here at the podium, and we were very grateful about that. So how do we measure what we've accomplished or not accomplished? Pretty much I look at the second most important measurement in America right now after the size of the president's hands, which is that 63,632 people died of overdose deaths in 2016, 42,000 of them from opioids. It is doubtlessly going to be higher in 2017. As far as I'm concerned, we haven't succeeded. We're failing. Until that number at least begins to come down, I will continue interviewing the families of people who have died, and I don't want to do that anymore. Mm-hmm. And you all will continue to see this going on. I looked at my own polling on stigma because we were asked to specifically address that. In 2017, a Marist poll showed that 53% of people believe that opioid addiction to prescription pain meds is an illness. 36% said it was a personal weakness, and 10% were unsure. That means 46% of the people in 2017 believe this is just a personal failing, or they're not quite sure about that. I guess that's progress. I don't know, but I don't think it's terrific progress. Similarly, around the same time, a CBS News poll asked, should it be handled, should addiction issues be handled by through the criminal justice system or through the medical system? 17% said the courts, 69% said the medical system, 3% said neither, and 5% said they didn't know. So I think that is progress. I think that one shows us some things that we didn't know. 5 years ago, I had never heard of, when I first started looking into this stuff, I had never heard of supervised consumption. Now, I think it is something that we in the media have brought into the mainstream discussion. As you all doubtless know, there's probably a supervised consumption site going to open somewhere in this country in the next 6 months or so, probably in defiance of the federal government. I think that we can help address stigma through our story choices. I think when folks who are in the field tell us what's going on and what's out there and what the newer developments are in working on this crisis, and we write about it, I think that helps to bring ideas that used to seem far-fetched into mainstream thinking, and I think that helps with stigma. Last thing I'm going to say, I am totally on a tear at the Washington Post about the language we use when we are writing about the opioid and drug addiction crises. We make mistakes every day. We are making fewer of them. The words that Colleen mentioned when she started this conversation appear less and less in the Washington Post, but they're still there. I look back at that 2015 story on the NAS babies, and the word junkie is in the middle of that story, and I sort of cringed. It's not around any longer, and I don't think it's in many Washington Post stories. We are working on the headlines, but I think we're improving our language, and I think we can help there too. So thanks.
Thank you. Great. Herman?
I'm Herman Lopez. I'm a senior reporter at Fox. So I've been covering the opioid epidemic for a few years now. But last year I went to Vermont to see, they built what they call a hub and spoke system. And it's a fancy name, but basically what they did is really integrated addiction treatment, scaled it up to provide more medications like buprenorphine, methadone to patients. And they really saw like an expansion of this treatment, like something like doubling of patients receiving opioid anti-addiction medications, which are proven in the research to really help people with opioid addiction. So when I went there, I was thinking, well, what are these officials going to tell me were the hurdles to getting this system in place? Why can't other states do this? And I expected it to be money. If you talk to politicians at all, they'll always complain about money. There's not enough money for this and that. It's a very common thing. But when I talked to the officials there, they said, no, it like money was a thing, right? Like they had to like get their financing in order. They had to like work with Medicaid and the federal government to get enough dollars in. But the biggest thing was just stigma. And this really surprised me. It was just the lack of political will in the state, even in liberal Vermont, right? The lack of political will there was alarming to me. And like the stigma was everywhere. I talked to a patient who's now on Suboxone, and he told me that in the years before, he had actually refused to get on this treatment because he believed the idea that it's just replacing one drug with another, and which is a really harmful myth surrounding Suboxone. And now when you talk to him, he says, I totally regret having that view and sharing it with others because this drug saved my life. But like these stories, like from the officials telling me that there was just a lack of political will with stigma, these patients themselves reflecting the stigma even on themselves, like these people who need this medication and saying, no, it's still like thinking that it's bad for them when it actually ended up saving their lives in their view. It's something that you see, that I've seen just like constantly covering this crisis. Another example is last year in Indiana County shut down a needle exchange program. If you look at the research on needle exchange programs, they're like should not be remotely controversial. They save lives, reduce HIV, reduce hepatitis C. Like they're proven public health interventions. And the Indiana County commissioners, when they were talking why they shut this down, they didn't say, oh, this study swayed me, it changed my mind. Some of them cited their religious beliefs. One of them explicitly cited the Bible and just framed it as this like moral issue. This is a moral failure, and the county would be allowing this moral failure to continue if it provided a needle exchange program. And I mean, for me, it's just looking at all of this and all this reporting I've done. Every single time I go to a story, I like almost hope that the issue is not stigma, but it is time and time again just coming back to that. And that's led me a lot to like reflect on how I cover this issue. Just like it really makes emphasizing like, hey, this like just basic facts of opioid addiction are really important to drive home in stories. Like we do actually have treatments that are fairly effective for treating them. A lot of people probably don't know that that most medical organizations, like I think all big public health organizations, consider it a disease, not a moral failure, and just it makes it a strange issue in that with a lot of other stories, you're not really covering the basics constantly, time and time again. With the opioid epidemic, you have to, because this stigma just has really created this strange view on how addiction works. And I mean, just personally reflecting on it, I look back at some of my stories, and I also find words in there that I wish I hadn't used before. Thankfully, I don't think I ever used the word junkie in this story, but but I have used like other words that like I think are still common, like addict. You should say people-centered language, like people with addiction. I have said drug abuse, like and abusers and heroin abusers and things like that, like language that isn't good. And again, similar to the Washington Post at Vox, we've changed our style guide. I've like worked with our copy editors to try to change our style guide so we have nicer language and things like that. But it's something that like just working in the media is something that I constantly think about in terms of like making sure we're framing the language correctly and all that thing. And just every news organization is going to make mistakes on this every once in a while. Try to avoid those and hopefully see fewer and fewer of them. But it's a thing. So yeah, that's really what I come away with in terms of like what I've been doing in my reporting. But another issue that I've seen in terms of like covering this issue is when you want to talk to like experts and public health officials and whatnot on the opioid epidemic, another way that stigma is really prevalent is that a lot of these people just frankly have outdated views on the opioid crisis. And this makes it like you hear them say something. I look up a study to like the research to see if there's any fact in it. Like our Secretary of Health and Human Services last year, he's now out due to a scandal, but Tom Price, he said he said that again he said that opioid addiction medications are just replacing one opioid with another, and he said that's not adequate. And it's strange because you would expect a top health official in the country to not ignore decades of research that suggests otherwise. But that adds another challenge in that like the sources you often go to with these stories, when you try to find like we try to find balanced stories, we try to find the other side sometimes. The other side can often just frankly have no idea what it's talking about. And that makes it really difficult to cover this crisis in that like a lot of the people talking about it just aren't that informed because of the stigma that has been in our culture, has been in our criminal justice system, and so on. And that creates obviously challenges for journalists who want to find like people from all over the country, all over the political spectrum in covering this issue. But it's a big problem as well. But I think those would be like the biggest things for me in terms of reporting this story. It's just like the constant prevalence of stigma. I mean, it has genuinely surprised me, and it's alarming not just because I worry how it shapes our public views. Like there is still a lot of media coverage out there that unfortunately still perpetuates the stigma, is not ahead in this conversation very well. And it, like what I try to do in my reporting is hopefully set a better example. I sometimes fail at that. I'm sure everyone else will say that they sometimes fail at this as well, but it's something that I constantly think about, and hopefully we'll get better at it.
That's great.
Josh?
Does this work? Okay. My name's Josh Katz. I'm a graphics editor with The Times. Of everyone on the stage, I've probably been reporting in this area the least. I've only been really doing this for about a year. So they all know much more than I do. So I'm going to try and keep this short. But I first started reporting on it. We have these weekly meetings where we just kind of like spitball, brainstorm ideas. And one of my editors asked me, she was like, I keep hearing about this opioid crisis, but like, can we try and put this in context? Like, how bad is it really? And so the first story I did on it tried to look at the death rate from drug overdoses and put that next to the death rate and the trajectory of the death rate from AIDS, gun deaths, and car crashes. And it was really in working on that story that I got a sense of how bad things were getting, and that this was really almost like the AIDS crisis of our generation is sort of what's happening now. And the parallels between the two, I think, are also really interesting. That was another case where there's a lot of stigma surrounding a population that really inhibited how we were able to respond to it. And I've been thinking more about, like, how do you kind of break through the noise to get readers to understand that this is something that affects them? For a lot of people, they know it affects them because they've, lost friends or relatives, but for people who don't, whose lives it doesn't touch as directly, I feel like there's been incredible journalism and incredible reporting about the epidemic and the crisis, painting these really, evocative pictures of what drug addiction is like for people. And it's amazing work, but occasionally I get the sense that readers look at it and say, wow, this is really horrible for them. But how do you bridge that gap to make readers think this is really horrible for us or for me? And how do you do that in a way that's not sensationalistic or fear-mongering? Local reporting, like the Cincinnati Enquirer piece and was the Charleston paper, countless others, has been really good and has done amazing work. But for every great story, then you'll see another one that talks about how, if you look at fentanyl, you will die. And it's, yeah, so it's, 2 steps forward, 1 step back a little bit. And I think that's something that, we all struggle with, of how to kind of break through that noise. And, just to throw my 2 cents in, I've also gone back and read some of my stories and have found a couple cringeworthy things. I'm not going to say what they were, but they're in there. Yeah. And let's see. I guess the last thing I'll say, and then we'll just go to the Q&A portion, is that language is important. I get that. And this probably isn't the room to bring this up, but screw it, gonna do it anyway. I have been trying to be very conscious about the language that I've used in my stories, and especially more so. Things that I didn't realize when I started reporting on it, like trying to avoid words like clean and dirty, was the biggest one that I didn't realize when I first started. But then there's things like, well, don't use the word addict, use the word person with an opioid use disorder. To be honest, if I go to a copy editor and say that, I'm going to get laughed out of the room. There's this tension between trying to avoid words that are stigmatizing while also trying to avoid medical jargon that I don't think we've solved yet, but I think it's very important that we try to address going forward. And I'm going to stop. Thanks.
Thank you. Great. So Rebecca, we're fortunate to have you here. This is part of your life's work. So just respond to kind of some of the themes that you heard here, kind of some of the things that you're trying to do at the Carter Center, and kind of maybe if you could kind of forecast a way forward here. What are the things that, I think Herman said that, for every one of him, there are probably 10 others that we need to work with. So just want to give your thoughts and reflections here.
I guess, because I'm not a journalist, but I've spent 15 years working with journalists. So in some ways, I'm kind of in that world, but yet I'm also in the mental health world. So my comments are framed kind of from that perspective. As was mentioned in my bio, the Carter Center has worked on the stigma of mental illnesses since Mrs. Carter left the White House all those years ago. And it's an issue that is near and dear to her heart. And about 20 years ago, she was sitting with her advisors, and they discovered that, you can carve away and chip away at changing public policy around mental health issues, which was some of their intent at that time. But you can only get so far if you don't have the political will and the power of the public to really push the issues. And as they examined what they could do to really address this problem, some really smart person in the room said, well, we need to work with the media because that's where most people get their health information. They need to know what we know. And so Mrs. Carter and her advisors developed the Rosalind Carter Fellowships for Mental Health Journalism. And I'm underscoring mental health there because until very recently, the focus of that program was on mental health. Very few, if any, of our fellows, I think there was one project until the last 2 years, focus on substance use. And we really tackled the issue of the stigma of mental illness and have learned a lot along the way related to that I think can be applied to substance use conditions. But it took somebody like Deborah Becker, who's a former fellow who's in the audience, to come to us and say, this is a really important issue. We knew that, but we're continuing as we move forward to really look at this issue because substance use conditions and mental illnesses are inextricably linked. You can't really talk about one without talking about the other. But I think there are some important lessons from our over 20 years working on mental health that can be applied to this particular topic. Journalists have a powerful role, and I want to commend all of you for the work that you're doing, and also other journalists in the audience. It's courageous work. It's hard work. These are not easy stories to tell. We hear that from our fellows. And for the mental health advocates out there, for those in academia, I think it's really important for you to know, it has been demonstrated so well on this panel, journalists want to get it right. And we have an important role in the behavioral health community in helping them get it right. Grant that interview when they reach out to you. Even though you might not really want to, you don't really want to go there, grant the interview, join with them, educate them about what you know. That's really, really important. In addition, meetings like this are so important. One thing Mrs. Carter discovered very early on in her work on mental illness is get unlikely partners in a room together and talk. And that is, stakeholders, everyone from policymakers to the media, to clinicians, to advocates, to people with the lived experience of substance use or mental illnesses. And these can be really difficult conversations to have. They can be really, really messy. But it is how you move forward as a field. So I commend Colleen and Johns Hopkins for having a meeting like this, a room like this, and following it with action. Things that we can really chew on and move forward with. In terms of journalists, and I think you all have done a really good job at this, but something we're really looking at the Carter Center is helping journalists get past ain't it awful. Everything's horrible. Telling all the doom and gloom stories, those can sometimes be the easier stories to find, easier stories to focus on, certainly the ones that sell and get the most eyeballs. But what's really important is to talk about what's working too. There can be a direct connection between this more solutions-focused kind of reporting and really impacting potential policy, potentially how communities respond to the issue. It's a tool that they can move forward. So really encouraging journalists to get past ain't it awful. But what journalists tell us at the Carter Center that they need in order to really do that is time and money. Two things that are really lacking in the media landscape these days. But I think, as illustrated by the Pulitzer Prizes yesterday, when you have a comprehensive effort in a newsroom, when you have editors involved, and you have multimedia involved, and you have social media involved, you can really propel some great reporting that has results. So I think this is where the behavioral health community, advocates, consumers of news can help is by purchasing the media, being there, buying it, putting, if you like something that you're reading, like it, share it. So many journalists live and die based on the number of shares and clicks they get through social media. That's our responsibility as consumers of news to help them with that, because money will flow to what eyeballs are seeing. So that's really important. And then finally, giving journalists the resources they need to do the work. I mean, so many of you mentioned words. and that words matter, and kind of going back to the your older reporting and kind of cringing, It's important to have something, at your fingertips. And Marie Gallo-Dyack of Entertainment Industries Council is here in the room, very involved in developing the AP style standards. Also, her work and the work of SAMHSA helps support the Carter Center's media guide on behavioral health reporting. There are some substance use standards in our media guide, and I have a few of those with me. If you're a journalist, happy to provide that to you. But having these things very easy, kind of to access at your fingertips, is really, really important. And then finally, I think it's important to recognize, when we talk about the role of the media in these issues, we're talking about all media. I think represented here on the stage today, we have a lot of national media. But as pointed out, I forget which one of you said, but the Cincinnati Enquirer yesterday with a Pulitzer Prize, but also the West Virginia paper with a Pulitzer last year. Having a very targeted approach, really supporting local and regional media on these issues, especially because we're gathered here today about the opioid epidemic in these really hard-hit areas. A lot of them are rural. A lot of them, the local newspaper is where a lot of the people get their news, and there's a huge impact that those media outlets can have on that community. And supporting that kind of work is something that the Carter Center is increasingly beginning to think about. And I know that Joe Pyle here from Scattergood Foundation has been doing a lot of workshop work related to that. But I would encourage journalists, not just national journalists, but local and regional journalists, to apply for grants, to apply for fellowships like ours, to seek out training. I know National Press Foundation just did a training workshop on the opioid epidemic. Get out there and get those resources, because what we've learned at the Carter Center, 1 in 7 of our fellows who we award year-long fellowships to do major projects on mental health or substance use conditions, they go on to impact public policy in some way. We've tracked this, we've measured it. A lot of those journalists actually are in local and regional media outlets as well. So don't want that to be forgotten in this conversation. I think that's very important. But I look forward to the Q&A and discussing more of these things further, checking my notes and making sure I didn't leave something off. I think I'll leave it at that.
Great. Good. Thank you, Rebecca, and thank you to all our panelists. We have about 20 minutes for questions and answers, and if you haven't noticed, there's microphones on both sides of the room. I want to start by following up on something some of you touched on and Rebecca raised, is this, how bad it is in the sensationalistic issues. This is not a Johns Hopkins worthy study, but I think most of us who kind of looked at the reporting on this have seen kind of the overriding narrative that kind of nothing works and, ain't it really bad? And just asking kind of the journalists up here if they experience that sort of tension either with their own reporting or particularly as it relates to working with their editors around stories and story ideas. But just kind of reflect a little bit more on that.
Well, speaking at Vox, one thing we have struggled with is, it is certainly true that readers seem to care more about awful news than the positive stories, and we do see that in terms of traffic numbers and things like that. That doesn't mean that people don't care about these stories at all. We have to try to do more positive, like the Vermont story I mentioned earlier. That was really finding a solution, hey, this is a state doing a really good job. They would tell you that they need to do more work, but that they're doing a good job relative to other states on the opioid epidemic. And that story did, a lot of people read it. It was really well trafficked and whatnot. So that to me has shown that people are interested in these solutions. I think one thing that I think about is there probably are not enough stories out there of like there are a lot of stories out there of people who are generally struggling with their addiction and have had a horrible time, but there aren't enough stories about people who are in recovery and doing well. Like there are a lot of people out there, probably millions, on these medications for opioid addiction. Their lives are just totally normal. Besides that, like they do not have the addiction problems, related problems that they had before, and all those issues. And we probably are not writing enough of those stories. Because whenever I go and visit one of these clinics and talk to those patients, I mean, there are plenty of them who are willing to talk. It's just a matter of reaching out to them. And that's one way I think about this. We could probably be doing more of those stories.
Thank you. Anybody else?
Well, of course, I mean, it's true that tragedy does attract eyeballs. I think at a baseline level, we all know that, and those are the stories that we are drawn to it both as readers and as writers. We are trained from the very first day to show people problems. That's what we do. We hold people accountable. We list what's wrong. We write about what's wrong. We don't write that often about the successful program. But I think with the opioid crisis, we've gotten to a level at this point where almost anything is going to draw eyeballs. People are just fascinated about all aspects of this. For example, it was only 3 or 4 years ago that there was an actual debate about whether we should be making naloxone more available in this country. I mean, there was a fairly spirited debate about whether or not that would contribute to more drug use. And I would say the media has had a pretty good-sized role in putting that to rest. And you see the result. So they may not be the ones you remember, but we are doing them. We should do more, but they are out there.
Good. Great, sir. You want to introduce yourself and?
Yeah, I don't think this is working. My name's Adam Kaplan. I'm a psychiatrist here at Johns Hopkins. Testing. Who now has a voice? So among the things I do treat people who have substance use. And I'm also touched personally in that it has affected loved ones. And it's all about language. And so, by the way, let me first start by commending everybody for getting the word out and really trying to address this national, international issue. But let me also challenge you a little bit. I've heard a couple of things. One is that I've heard, substance use or mental illness. And I would contend that substance use is a type of mental illness. So to separate it is to kind of say, we have stigma, we don't want that stigma. And I would contend that, if not a mental illness, what kind of illness is it? And then the other thing is disease. And I will tell you, disease is a tough one because we want to appropriate the idea that this is not your fault, it's not your responsibility, but people kind of get that there's a disingenuous component there. Because if it's a disease and people are doing the kinds of things that they're doing, which is self-injurious and the like, crazy things. We would put those people in the hospital against their will sometimes if they're doing crazy things when they have a disease like schizophrenia. But I don't think we're at the point now where we would say we want to put people with substance use issues in the hospital. The other component is that there needs to be an element of engagement. So unlike a disease, the person has to want to get the treatment. Someone doesn't have to want to get the treatment. We sometimes compel them. Kids get shots, whether they like it or not. So the disease, I have a problem with. It's a brain hijacking illness. But is it really a disease, and are we doing something disingenuous by trying to appropriate something that doesn't quite fit?
Anybody want to touch that one? No, but I think maybe if I could just kind of respond a little bit. I think it's really important, quite honestly. So one, we have many diseases that often start by people making choices in their life, right? And so I think that's part of the issue here. People have to have some level of motivation to want any sort of treatment, not just with addiction. I would say as healthcare system, we systemically motivate people and empower people to seek care. And we don't do that for people with substance use disorders. We actually wait till they get to their most acute condition before we deem them motivated to seek treatment. So I would say both as a person with a disorder, but also as a person who works within a healthcare delivery system, to basically say, like, yes, these are the same components that happen with other diseases, that yes, there are a wide variety of people who are not treatment seekers, and we in the healthcare business have a right and an obligation to help motivate and empower people to seek care. So I'm taking some editorial liberties here to do that. But folks, do you want to?
Yeah, I wanted to add to that because I think your point about language is so important. And I think we're still trying to find our way in this area around that. And I think we really need some research around the effectiveness of certain types of language. We know from the mental illness world, through the work of researcher Bernice Pescasolido, a sociologist doing work on this, that when we use the term a brain disease describing mental illness, it actually increased stigma. There was this perception that it was a permanent condition from which someone cannot recover. And so I think it's really, really important, such an important point, and I think we need more research on it to really figure out how we need to talk about this.
Josh?
Great.
Dr. Sharf?
Well, go ahead.
I just wanted
I'm sorry.
to add one thing in terms of like what I thought when you were saying that is all the times my doctors have told me to like stop eating so much junk food, not smoke, and all of that, because like these things do lead to diseases, and you are making a choice there. So I think, but what I think of there is that a lot of people do, as reporters, we should be aware that a lot of people do see this like as starting with a choice to start drug use, and then that gets you in trouble down the line. But one thing that's important there is, like, first of all, as a reporter, you should explain why it's still considered a disease, even if it starts with a choice or an illness or whatever we ultimately find out is the best way to refer to it. But another way to look at it is most people who use drugs do not get an addiction. Like they do not develop an addiction down the line. Most people who are using alcohol will turn out to, they might have medical problems down the line related to that, but they are very unlikely to develop an addiction. And like that should tell you that a lot of people are making the choice to start using this drug, but something else is what drives them to eventually go down to addiction. And I think like explaining that in stories can be really helpful to readers. And it kind of goes back to like what I said earlier, that we are still explaining a lot of the basic stuff in terms of addiction, the opioid epidemic, and that's really important in journalism.
Good point. Thanks, Josh Sharfstein. My observation is that journalists are doing better thinking about addiction as an illness, but not much better thinking about addiction as a treatable illness. And right now, the New York Times homepage has a story that says, "Rehab rarely works for opioid addicts." Okay, and what's that? Rehab rarely works for opioid addicts. And even and the mental game that I play when I'm reading these stories, I don't mean that there are some things that work. I mean that it's a treatable, that many, many people, there's enormous evidence for treatment. It'd be like doing a story on patients with cancer and not talking about whether they're going to the doctor, if it's a treatable cancer, or HIV. Stories where you're talking, to moms of babies who have NAS, and they're saying, I don't want to be in treatment, or, but the story isn't really talking about the fact that treatment even exists. It just sort of takes as a given. Even programs, I think there are many different programs that have different kinds of things, but the fact that it is fundamentally treatable seems missed. That would be my perception of one of the major challenges. And in fact, the experience we had in Baltimore when we did do a big expansion using buprenorphine in the mid-2000s was that the local newspaper wrote 5,000 words saying that, it was worse than heroin itself. The first line of the series was, "There's a new drug on the street and the government put it there." And so there's actually a history of like wanting to say, gotcha, you think you're trying to treat something and there's something wrong has happened. Of course, treatment programs can go awry, but fundamentally, it's a treatable disease. And I'd just be curious whether you, how that plays out in your work.
Was that to me?
And no, anybody.
No, I mean, that's a great point. I don't really know if there was a question in there. It seemed more like, but no, you're absolutely right, basically.
Why don't people, do you agree with the idea that journalists don't come at it and ask the question? I mean, the Pulitzer Prize winning series, which I thought was great, did not focus on treatment. And
Right.
If it were HIV, if it were cancer, how do you do a series on that without saying whether or not people can actually access the treatment that exists?
Sure.
So, why is it missing?
I mean, I feel like you probably know the reasons why, and that it's kind of what we've been talking about all along, that it has to do with stigma, that it has to do with this perception of people choosing this, and the, not really seeing it as a disease, much less a treatable disease or illness or whatever. But I don't really have any more insight into that.
I think the vast majority of treatment stories that I see are policy stories that talk about the fact that there is not nearly enough treatment. And so by implication, that if we did have more treatment, we could make a dent in the epidemic and in the crisis. And therefore that for some folks, maybe it will take numerous attempts, but it is treatable. I think that's where we tend to focus, because we're not hearing, the message we're getting is that a tiny fraction of people who need it are getting treatment, and we are writing that and we are saying that. I think at the local level, people have concluded that they're not going to be getting much help in the way of money from DC, and they are taking what steps they can on their own. But you're right that we don't say this is a treatable disease. We do, however, say treatment is essential to get us out of this crisis, and we need a lot more of it.
Can I just add to that one of the biggest challenges our journalists tell me, and I spend a lot of time with them on the phone related to this, is actually finding people living in recovery or are currently active substance users willing to go on the record to talk about their story. And I'm putting that out there because I think this is the role for the advocacy community and the clinical community to help support this and provide stories to journalists, I think is really important. I also just can't underscore enough, and this is the other thing I'm hearing more and more from our journalists, is they don't have the time to really dig into the story and figure out these different angles. And I think this points to the need for more training to really understand what effective treatments are out there, and take the time to learn about those.
And sort of to that, I would just say that in terms of finding people to go on the record, it's always kind of the most visible cases are the easiest to find and the most willing to go on the record, which sort of leads to this thing where drug addiction just gets described in the most extreme terms, and oftentimes the really just kind of prosaic, run-of-the-mill, sort of boring aspects of drug addiction get missed. Because those sources are harder to find, I think.
And what I'm hearing is they're harder to find because of social media, because that story lives online forever. So when they're in recovery and trying to find a job and all of that, that's all out there. So people are much more hesitant to go on the record.
Hi, thank you all for your excellent remarks. My name is Ayelet Hines. I'm with the Center on Alcohol Marketing and Youth here at the school, and I teach Introduction to Campaigning and Organizing. So much of what we do in advocacy in public health is try to shift a story from being one about an individual and their problems, their treatment, their stigma, to shining a light on the social justice issues behind the individual's problems. I'm wondering what your thoughts are on how this issue could perhaps be reframed, taken, I guess, pulling back a bit from the problems that individuals face to the social justice problems that would drive people to opioids in the first place, like why these diseases of despair in the first place. So I know you've all done some like excellent thinking on how you frame this, and a couple of you have touched on this a bit, but I'd love to hear more about your thoughts.
Well, speaking personally, I think one thing is when looking at the opioid epidemic, it's like one thing I've been trying to think of more is framing it as just first of all, it's a drug addiction problem in terms of like it's not just opioids that alcohol is also linked to 88,000 deaths each year, and there are like cigarettes kill 480,000 people each year, and like so that's one way I've been trying to think about framing this in terms of like this is really a part of a broad addiction crisis, and it's like that helps you, I think, grapple with the lack of treatment more in terms of like we really are failing in all aspects of our healthcare system in terms of treating addiction, and for me at least it has been helpful for addressing that. One thing as well is like addressing in terms of framing this issue, I think we have really driven this point home that it's like an epidemic of white rural areas. And in recent years, we're seeing that change. It's going into cities more. It's affecting people of color more. And in terms of framing that issue, it's something that I think journalists in general need to do a better job thinking about it. It's like this is really something that is now affecting all swaths of America. And it also helps, like Josh earlier said, that it's really weird. Like sometimes you get reader feedback like, okay, so this affects those people, but it doesn't affect me. As it spreads to other parts of the country, that indicates that this is one way that it does actually affect you and will actually hit you. So I think looking more broadly helps a lot. That's essentially what I'm getting at is like this is affecting all sorts of groups, and it's not just opioids, it's these deaths of despair, it's suicide, it's alcohol. I would honestly include even like tobacco addiction in there, which I don't think it's nearly enough attention given how many deaths it causes each year. And we like really just looking at all these issues comprehensively helps drive home that this is something that's affecting a lot of people and people should care about.
Sounds good. I want to get one more question here. So, Susan?
Susan Sherman at the Department of Health Behavioral Society and with the Bloomberg American Health Initiative. It really builds off the last comment, which I appreciate what you said, but instead of looking at individuals with problems, turning to society, why do we have, and by the way, having worked in Baltimore for 20 years, it's always been, African Americans have always been in the mix of overdoses. And we started the first overdose prevention program in 2003 with the health department. So that never left. The conversation may have left or picked up. And now, we can talk about safe consumption space openly. But that's a digression. Turning the spotlight out to kind of why places in Baltimore don't have jobs. Schools are failing. Kids have to, bring tape for their books. I mean, that's the kind of social injustice. Then you see how the corner boys are so appealing because they have money in their pocket, because they're the only ones, many of the people working in your neighborhood. Like, how does that get reported? Because to me, that's the social justice issue. It's not, it's about the economics of a country that lets these voids happen, whether it be in West Virginia with, coal industries going, or Baltimore City 30 years ago with industries going. Like, is that sexy? How does that enter the narrative? I mean, it's not so sexy, unfortunately, but how does that enter the narrative when talking about addiction and this individual disease, which actually really is a societal disease?
Well, it doesn't, because it's not, we in the media wouldn't see that as a news story. we would feel that, gosh, we've been writing about those issues for decades. And unless we could find a way to frame those in a kind of a new way, where we could tell you something that you didn't really know before, we would be very hard-pressed to do that. We did a series all year last year on dying in small-town America because we felt like, okay, well, we could at least, and we just focused on women because men had received so much attention during the financial crisis. So we just wrote about women dying in small-town America, and we felt like, okay, we're going to be bringing up a lot of social issues that have been covered and that everybody, all our readers know, but we maybe can bring them up in a different way or a different location. And it was pretty successful, but you know, we're just not great at raising those backdrop issues that everyone knows are behind things like the drug crisis.
One thing I would add to that is because it involves so many issues, this is also difficult for a single reporter working on a story to really wrap his or her head around this. So like, I know a lot about opioid issues and drug policy, or at least I like to think I know a lot about those. But if you ask me about monetary policy or how you fix schools or that kind of thing, I have no idea. I honestly, like, I'll have, like, I have ill-informed opinions about those issues. But like, as like, in terms of like putting that in writing and reporting on it, it becomes much more difficult because now I have to essentially report on a lot of stories. For example, if I went around this room and asked, how do you fix the poverty in some of these neighborhoods that may drive people to opioid addiction, I'm sure everyone in this room would have a different idea, and like that's exactly what you hear when you talk to experts about this. So it becomes like you really have to essentially learn to report an entirely new beat, and that really makes it difficult to fully grapple with all of the social justice issues involved in this. That doesn't mean that reporters shouldn't do it. They can work with their coworkers to know more about these issues, and that they can just try to get like help from nonprofit groups and whatnot to like really help the reporting. But like in terms of like a single reporter working on a story, it's a pretty significant challenge.
But you did that in your West Virginia piece. You did a good job of framing West Virginia, by the way.
Oh, thank you.
That's good. That's a nice note to stop on. But I really want to thank all of our panelists today for their not only for their coverage, but for their candor. I think all of us, were kind of nicely surprised by your willingness, I think, to do some level of self-examination on kind of not only kind of your coverage, but how you do what you do and why you do what you do. So thank you all for being here today.